What is hypertension? It's a persistent elevation of the blood pressure. There are two stages, stage 1 and stage 2. Stage 1 is above 130 to 139 mmHg systolic or above 80 to 89 diastolic. Stage 2 is above 140 mmHg systolic or above 90 mmHg. Nearly half of the people with high blood pressure do not have it under control, about 45.6%. Many individuals with diagnosed hypertension are not treated or are treated inaccurately, leaving the condition uncontrolled and the person at risk for other serious diseases. Etiology of hypertension. Hypertension is not considered a disease, but rather a physical finding or symptom. Elevated blood pressure affects the condition of the heart, with increased risk of CVD, end-stage renal disease, atherosclerosis, and potentially resulting in congestive heart failure, myocardial infarction, cerebrovascular accident, which is including a stroke, and kidney failure. Cause for hypertension. The following consistent conditions might contribute to hypertension: alcohol intake more than one standard drink per day, anxiety disorders, delirium, hyperinsulinism with insulin resistance, obesity, pain acute and chronic, pregnancy, sleep apnea, and smoking. In pregnancy, there could be something called preeclampsia, which is an elevator of high blood pressure due to pregnancy.
There are predispositions such as age, race, and sex that can put an individual at greater risk of developing hypertension. Those over 40 years of age are at a greater risk due to age-related pathologic changes within coronary arteries that can be severe enough to cause hypertensive symptoms. Black and Hispanic individuals are more likely to have cardiovascular disease related to hypertension than white individuals and Pacific Islanders. Exact reasoning for this disparity is actually unknown, but there has been connections made to salt sensitivity, body mass, social determinants, access to care, and differential treatment response. When it comes to sex, men are 4 times more likely to have coronary heart disease related to hypertension than women, predominantly linked to less use of healthcare and less awareness of the signs, symptoms, and cause of hypertension. There are 2 known types of hypertension. Primary hypertension has no known secondary cause, but is the most common type. It can either have a gradual or abrupt onset and last for a short amount of time. This type of hypertension is typically experienced due to environmental factors such as lack of exercise or moments of stress. Secondary hypertension is usually as a result of another medical condition. Some conditions, such as those that may affect the kidneys, arteries, heart, or endocrine system, may also cause hypertension to occur. Those with secondary hypertension may be asymptomatic and therefore may not even know they have hypertension as a result of their current medical condition. Early signs and symptoms of secondary hypertension include vision changes, dizziness, ringing in ears, just to name a few. More advanced signs and symptoms, such as hemorrhages, left ventricle enlargement, angina pectoris, and renal failure, are also possible. Hypertension can affect many different systems within the body, causing harm to several important organs. As blood pressure continues to rise, so does the risk of developing serious problems associated with the heart and the circulatory system, such as heart disease and heart attack. In addition, hypertension can cause blockage or hemorrhage of major arteries that supply the brain with blood and oxygen, potentially causing a stroke or serious brain complications. As a result, speech disabilities, movement difficulties, and potentially death could occur. In addition, the lack of blood flow to the kidneys caused by hypertension may contribute to the dysfunction of these important organs, and the development of kidney disease could occur. Kidneys then lose their ability to filter blood and regulate the fluids, hormones, acids, and salts within the body. Overall, kidney failure may result from uncontrolled and untreated hypertension. Therefore, potential serious harm could manifest as a result of hypertension, especially if it goes untreated and becomes more severe.
Clinical features. What are the signs and symptoms of hypertension? Most people with high blood pressure do not experience any symptoms, even if the levels are dangerously high. A few people may experience headaches, shortness of breath, and nosebleeds, but even these symptoms are not specific and usually do not occur until high blood pressure is at a very dangerous stage. When high blood pressure is left untreated, this can result in a hypertensive crisis. Hypertensive crisis is a severe and life-threatening increase in blood pressure. These signs and symptoms may include severe anxiety, severe chest pain, dyspnea, severe headaches with blurred vision and confusion, nausea and vomiting, seizures, and unresponsiveness. When hypertension is symptomatic, symptoms may be manifested by malignant hypertension. Malignant hypertension is also known as a hypertensive emergency. These symptoms are characterized by severe headaches, nausea and/or vomiting, confusion, visual changes, and nosebleeds. Medical treatment for hypertension. Lifestyle changes are the main focuses when combating hypertension. Some patients will only need to watch their dietary consumptions of sodium and saturated fats. Others may need to reduce their daily stress levels. In the occasion that a patient needs drug therapy, periodic monitoring is essential. Drugs can either stabilize or elevate the condition depending on the drug that is needed. These include diuretics, which promote renal excretion of water and sodium ions, sympatholytic agents, which modify sympathetic nerve activity, and vasodilators, which increase blood vessel size and facilitate blood flow. There are many symptoms that someone may experience while going through hypertensive drug therapies. These include fatigue, cramps, GI disturbances, xerostomia, nausea, depression, and orthostatic hypotension accompanied with dizziness.
Next, we're going to talk about the alterations to the dental hygiene process of care, known as ADPI. And those steps involve assessment, diagnosis, planning, implementation, and evaluation. So involved in those steps, we're going to assess the patient, we're going to diagnose the problem, we're going to create a sequential treatment plan, we're going to do our implementation, and we're going to finish off with an evaluation. During the assessment phase of treatment, we want to know if our client should see their physician prior to dental hygiene treatment. So if their blood pressure is greater than or equal to 130/85, we would like them to see their physician prior to treatment. Also, if our client has diabetes, a medical consult is advised prior to dental hygiene treatment. Do we need a medical clearance? So for a medical clearance, for most clients, it is not needed if they have hypertension, but vitals should be taken on every client prior to every appointment, and a risk assessment should be done based on the vital values. So when you sit your patient down and you take their blood pressure, if you notice any risk factors that are involved, including smoking or diabetes, then a risk assessment should be completed, along with any higher than normal values that the client is seeing. So if a client doesn't have any history of high blood pressure and they do have high blood pressure, then that's something we might want to send them off to their doctor for. So on this slide here, we have the blood pressure values from the CDHO website. And there's two different charts that we like to use in the clinic at SODC. So one chart shows without history of hypertension, so values that we go by, whether we can proceed with treatment, whether we should proceed with caution, or whether we should not proceed with treatment, if they have a history or if they don't have a history. So any numbers that are seen in red, we should not proceed with treatment. And then there is instructions given by the CDHO. Any values seen in yellow, we should proceed with caution, and also instructions given by the CDHO. and anything seen in green is okay to go ahead with dental hygiene treatment. And on this chart, we have the same chart but with a history of hypertension. So these values differ a little bit because of the client having a history of high blood pressure. So once again, values in red are cannot proceed with treatment. Yet values in yellow are proceed with caution, and values in green are okay to proceed with dental hygiene treatment. So is antibiotic prophylaxis needed? So for hypertension, no antibiotic prophylaxis is needed unless the client has a history or other illnesses, diseases, infections, or surgeries that require prophylaxis antibiotics. So hypertension itself does not require antibiotic prophylaxis prior to treatment, but if the client has a history of other things such as infective endocarditis or has had any joint replacements or anything like that, then we want to make sure that we contact their surgeon or doctor to make sure that we give them the proper antibiotics prior to their dental hygiene treatment. So when would treatment need to be postponed? So when should a dental hygienist or a dental hygiene student need to postpone treatment on a client? When values are contraindicated or any other signs and symptoms are present. So according to the charts that we showed from the CDHO prior, any values that are shown in red, we would need to postpone treatment with a history or without a history of hypertension. Also, if the client comes in with any other signs and symptoms, such as a headache, fatigue or confusion, vision problems, chest pain, difficulty breathing, and if their respirations and pulse are irregular, then we would also need to postpone treatment. So what are the oral manifestations of hypertension? There are no specific oral manifestations to hypertension, but there are also factors such as smoking, which has well-known oral manifestations. The oral manifestations related to hypertension come from the medications used to treat it rather than the condition itself. Side effects of hypertensive medications include chronic cough, taste changes, angioedema of the lips, face, tongue, upper respiratory tract infections, gingival hyperplasia, dry mouth, lichenoid reactions, and lupus-like oral and skin lesions. So what should be considered during our implementation? Many antihypertensive drugs can have side effects such as dizziness or lightheadedness. Dental hygienists can minimize the client's lightheadedness or fainting by avoiding rapid chair position changes. Warn the client prior to chair changes and ask them if it's okay to lay them back prior to doing so. Alpha A blockers can cause nasal congestion, which should be taken into account where nasal breathing is relied upon, especially when you're in their mouth and especially during aerosol producing procedures such as ultrasonic. They really do rely on nose breathing, so make sure that that is discussed prior to laying them back and during their medical history as well. So implementation considerations continued. Beta blockers can result in dizziness, bronchospasm, and masking of hypoglycemia. The dental hygienist should be alert to possible drug side effects. The office you are working at should have appropriate first aid equipment nearby if needed. Dental hygienists should educate clients about abnormal vital signs, including blood pressure and other vitals such as respiratory rate and pulse, and recommend them to a medical referral when appropriate. Dental hygienists should counsel patients and clients who smoke, particularly those who are hypertensive, to stop smoking and refer them to smoking cessation programs in their local communities. So for our last stage of our ADPI considerations, we have evaluation. When evaluating the client's goals, ensure that since their last appointment they have seen their family physician if directed to, continued taking their antihypertensive, or started taking new medications for high blood pressure, just making sure that the hypertension is under control and that they are under the care of a physician. And if they committed to a smoking cessation program if directed to. Make sure to properly record these goals as met, not met, partially met, or ongoing in the client's care plan.